Hello, everybody. Thanks for coming to listen to our research project, whose title is Advancing Racial Equity Through Community Involvement in Newborn Drug Testing, a justice-informed participatory mixed method study. So for our introduction, Michigan is one of 25 states that considers maternal drug use during pregnancy to be child abuse, and thus it mandates healthcare professionals to report cases of newborn drug exposure to Child Protective Services, or CPS. In Michigan, CPS often relies on the results of newborn drug testing when it decides whether or not to open a case on a family. While this can protect families and infants, it can also lead to criminalization of substance use in pregnancy, and it can undermine trust in the healthcare system among impacted families. Further, numerous studies have shown that racial bias may occur in newborn drug testing. In a previous quantitative arm of our study that involved 27,000 pregnancies at Michigan Medicine, we found that clinicians are far more likely to order newborn drug testing on Black newborns than white newborns, with an unadjusted odds ratio of 2.7 and an adjusted odds ratio of 1.4. In this arm of our study, we sought to explore clinician attitudes, knowledge, and practices regarding newborn drug testing. So we interviewed 15 multidisciplinary stakeholders, including physicians, nurses, midwives, social workers, and CPS employees. Our interview scripts were guided by the theoretical constructs of anti-racism, criminalization of pregnancy, and harm reduction. We then used an inductive approach to perform thematic analysis. For our results, we identified 7 main themes from our interviews with stakeholders, which you can see here. We included a quote that we think best exemplifies the theme under the heading. Themes included, first, racial bias in newborn drug testing, as well as other biases, such as status of maternal marriage or single status, as well as socioeconomic status. Second, there is a relationship between newborn safety and family preservation, and the two are often at odds with each other, or at least seem to be. 3 is that there's confusion regarding the legal obligations and the consequences of newborn drug testing, where stakeholders expressed that they were unsure when to order testing, if testing was actually the right thing to do, or if it just created more problems for the family and for Child Protective Services, a higher burden for them. 4th was that harm reduction is important, and stakeholders expressed a desire to help pregnant patients overcome substance use disorder. 5th, there was conflict between informed consent and mandatory reporting. People thought it was not possible to obtain informed consent prior to testing, since it's a legal requirement and cannot necessarily be declined. 6 is that there's an importance of improving prenatal practices that lead to disparities in newborn drug testing, including the need for linking families up with substance use disorder treatment. And then finally, 7, the need for multidisciplinary collaboration to care for families who have been impacted by substance use disorder. From this study, we concluded that in addition to racial bias at our institution, there are many other factors that influence the decision to order newborn drug testing on newborns, and that the reasons are complex and not always well understood, even by those who place the orders. Next steps for our project include conducting additional interviews with providers, then conducting interviews with patients whose newborns underwent newborn drug testing to better understand the patient perspective on how it impacts them moving forward. Further, we will plan to present this data to key stakeholders at Michigan Medicine in an effort to guide quality improvement interventions that will promote equity in newborn drug testing at our institution. Finally, we would like to acknowledge that funding for this research was supported by the University of Michigan Office of the Vice President for Research and the National Center for Institutional Diversity. Thanks so much for your attention.